Hi, my name is Sumi Chang. I'm the Executive Director for the Ontario Public Health Association. Thank you very much for joining us today on this very interesting and very important topic on provincial food insecurity status, looking at both nutritious food basket and household food insecurity. I'd like to introduce my research intern, Aisha, who is interning with us for the summertime and who will be presenting and facilitating the rest of this presentation. Ms. Khan is currently working as a research assistant with us. She has completed her master's in public health from the University of Buffalo with a concentration in epidemiology, and she'll be presenting the descriptive analysis of the nutritious food basket here in Ontario, and also speaking to some of the assumptions and limitations, and she'll also facilitate and introduce our guest speaker today.
Hi, good afternoon. So I'll jump right into the descriptive analysis of the nutritious food basket, and I'll be referring to it as the NFB the remaining of my presentation. So the NFB is a survey tool. Wait, let me just click next to my slide. So the NFB is a survey tool that is a measure of the cost of basic healthy eating. Food costing is used to monitor both affordability and accessibility of foods on individual and household incomes. The survey reflects an eating pattern that meets the recommendations of the Eating Well with Canada's food guide and also accounts for the actual eating behaviors and food purchasing patterns highlighted in the Canadian Community Health Survey results. The NFB food costing survey includes 67 basic foods from all the 4 food groups. It is administered annually by the ministry in all 36 public health units. So for the purpose of the study, data was analyzed for 2009 to 2011, and data before 2009 is not comparable since the data collection methodology has changed. OPHA is still waiting for 2012 data from 13 public health units, and we have already made a request to the remaining public health units to please submit the NFB data results. And if those public health units haven't yet done so, we would really appreciate it if you did, so we can go ahead and also analyze the 2012 data of NFB and include them in our trend analysis as well. So moving on to this, what is included in the NFB projects? These are the list of foods that are included, where a minimum of 6 stores were surveyed. The NFB reflects the average lowest price for a specified purchase size, regardless of food brand. The Ministry of Health and Long-Term Care requires that the annual NFB costing is conducted during the month of May. The pricing survey results are used to estimate the average cost of feeding 22 age and gender groups with a reference family of 4. And there are a lot of assumptions to the survey, and these assumptions again are listed by the ministry and in the NFB survey guidance document. And I think I would like to bring your attention to one of the most important assumptions of the survey, which is that the data simply represents scenarios if a family is to purchase the NFB, as we cannot assume that everyone in Ontario has actually bought the food basket. Moving on to limitations. One of the major limitations of the NFB is that it does not account for culturally diverse foods, and this is an underestimation, as we know that Ontario is a very culturally diverse province. And also, since so many of these other everyday essential items are not accounted for in the NFB survey, such as other household items like buying kitchen rolls or toilet paper, so it can only be hypothesized that the actual cost of the NFB is higher than estimated. Now it's time for a poll, and we thought it would be a good idea to kick off the presentation. So the question should appear on your computer screens with options, and I can read it out to you, and I think it's coming up now. Is it up? Okay, so the question is, what percentage of income does a family of 4, which is basically 2 adults, males and females, a male and a female between the ages of 31 and 50, and 2 children, aged 8 and 14, on an Ontario Works income spend towards purchasing the NFB? And the options are 10%, 14%, 30%, or 40%. So the poll is now open, and I'm just going to give some time for everyone to click on an answer. How do I see it? Okay, so I think everyone's almost done signing up for it. And okay, that's good. Thank you. And I think everyone is almost done. So I will close the poll now. And I will not reveal the correct answer just yet because I'll just wait till the end of the presentation when everyone has seen all of the descriptive analysis. And then I think as a group, we can arrive at the correct answer ourselves. So moving on, jumping into the analysis, I must add a major assumption, like bring it up again, is that all of the descriptive analysis has been performed on a reference family of 4, which basically consists of 2 adults and 2 children. Okay, so this is the first graph. This graph demonstrates the cost of the NFB in northern and southern regions in Ontario over the span of 3 years, so from 2009 to 2011. And these costs have been calculated by individual public health units and submitted to OPHA. The northern regions refer to Northwestern, Thunder Bay, Porcupine, Algoma, Timiskaming, Sudbury, and North Bay Parry Sound District. And all of the remaining public health units are referred to as southern regions. So looking at this graph, we can conclude that the NFB is more costly in the northern regions, and as well as the cost of healthy eating is increasing over the years. And as the price of NFB is also increasing. For instance, if you look at this, in 2011, the highest point up there is for the nominal value of $212, and that's actually the cost for Northwestern Health Unit, as they have consistently reported being the most, their public health unit has consistently reported that their NFB cost is the most expensive in Ontario. Compared to the least expensive, which was reported by Durham Region Health Unit this year, which was only at $163. Moving on to our second graph. The dotted lines are northern regions and the solid lines are southern regions. And if you see the legend on the right, OW stands for Ontario Works and MW stands for minimum wage. So this graph illustrates that the percentage of income a family of 4 would have to spend on buying the NFB. So families on Ontario Works income would have to spend almost 40% of the income in buying the healthy food basket. Families on minimum wage would have to spend approximately 30% of their income, whereas families on median Ontario income would only have to spend about 13% of the income on buying the NFB. These percentages are alarming because if a family of 4 is to buy the NFB, less funds will be available for other necessities such as telephone, childcare, transportation, etc. Hence, we observe that families that earning the median Ontario income would have been consistently required to spend a smaller proportion of their monthly income on the NFB than families on Ontario Works, regardless if they are in the northern or southern public health units. And moving on to our next graph. So this graph shows the comparison with nominal dollar values of the cost of the monthly NFB on the y-axis and the total percentage of income being allocated to buy the NFB in all 3 scenarios. So again, Ontario Works, minimum wage, and median Ontario income. So what we observe over the 3 years is that even despite increased cost of NFB in northern regions, families on median Ontario income are only allocating a range of 12 to 15% of the income in buying the food basket compared to families on social assistance where they're spending a lot more. And it can be seen that families who earn the median Ontario income would need to spend far less of their monthly dollars to buy the NFB. On the other hand, families on Ontario Works are spending anywhere between 35 to 48% of their monthly income to purchase the NFB. And this contrast demonstrates that the level of funds required to purchase the NFB would affect families on Ontario Works much differently than those earning the median Ontario income. And over to our last graph, we see that, so this graph shows that the amount of residual income left for a family of 4 on Ontario Works, minimum wage, and median Ontario income after they buy the NFB and also pay rent. And again, I collated this by northern and southern regions and also Ontario as a whole. And basically, based on assumptions that every family of 4 purchased the NFB in the year of 2011, we observed that for a family of 4 on social assistance, they'll only have about 13% of the income left over after they paid rent and bought the healthy food basket, as compared to 70% of income left over for a family of four on median interior income. And again, just looking at the nominal values, a family of four would have approximately only $250 left over to cover expenses such as household items and childcare. That, whereas a family of median income would have approximately like 4,203 left over to cover additional monthly expenses. And that is just. And now I would also like to point out that sadly, Dr. Fiona Udall had an unexpected commitment, and so she was unable to attend the webinar session today, but she does send her sincere apologies, and hopefully in the near future, OPHA will be working alongside with her to organize another webinar. And for now, I would like to introduce our next speaker, Dr. Valerie Tarasuk. And Dr. Tarasuk is a professor in the Department of Nutritional Sciences. Her research focus is on food insecurity in Canada, and she examines the public policy issues associated with it. She is currently leads a program of research designed to identify effective policy interventions for the reduction of the household food insecurity in Canada. And so just moving on to Dr. Tarasuk.
Thank you. Thanks. It's a pleasure to participate in this webinar. I'm sorry Fiona can't be here, but it is giving me an opportunity to do a little bit more talking. What I want to talk about today is food insecurity measurement and the results of the most recent measurement tool that we've got. As Aisha told you, I lead a research program on policy intervention, and we are tooling up to do an annual report on food insecurity in Canada. What I'm showing you on this screen is a very kind of crude summary of the way in which food insecurity is measured on the Canadian Community Health Survey. And I'm showing you this because I really want you to be clear on what I'm talking about when I talk about household food insecurity in this presentation. Since 2004, we've been including on the Canadian Community Health Survey an 18-question module that was initially developed in the United States for monitoring there. And it's a very well-designed instrument that captures ranges of severity in food insecurity, ranging from worrying about not having enough food to compromises in quality, and so things like not being able to afford a balanced meal, and finally to compromises in quantity that range from skipping meals to not having enough to eat, going hungry, and lastly to not eating for whole days at a time. Always these questions have the clause "because there wasn't enough money for food" attached to them as a way to anchor them in the problem of financial constraints. So when I talk about household food insecurity, I'm talking about people's responses to these 18 questions. And it's absolutely an income-related constraint because of the way the questions are being asked. My screen's just changed. Okay, I see myself there. But when I'm seeing myself, it's covering part of my slide. Okay, I'm just getting some instructions here. As you can see, this isn't really what I do for a living. Okay, let me carry on though and talk about what you're seeing on this slide, because hopefully you're seeing something that looks a little bit different than me. This is a pie graph of household food insecurity from the Canadian Community Health Survey from 2011. That's the most recent survey for which we have data available, and it's going to be the subject of our new annual report. What we've done is grouped households who responded affirmatively to one or more items on that 18-item module into three categories. So severe food insecurity, the 2.5%, is a very bad problem. Those are people who responded affirmatively to enough of those items for us to conclude that there were compromises in the quantity of food consumed somewhere during that previous 12-month period when the measure took place. So severe food insecurity is a very serious problem, and it's linked to a number of very, very serious health outcomes. Moderate food insecurity are people who reported enough for us to be fairly confident that there's been qualitative compromises in the food in the household, but not necessarily reductions in total food intake, whereas with the severe amongst adults or children, we would have to conclude there have been at times reductions in food intake because of a lack of food or money for food. The marginal food insecurity category is one that has not been reported in Canada up till now, but we are reporting it in our research now, and we're reporting it in our annual report on this 2011 survey. And these are people who responded affirmatively to one or two of those questions, not enough to get them classified as moderate or severely food insecure, but enough for us to know that that household was experiencing some constraints. Research by our group and by others in Canada and the United States indicates that to say yes to any question on that 18-item survey is a terrible thing, and it indicates a family or a household that is constrained. So the marginal category we're including in these reports. All told, we've got 12.3% of households experiencing some level of food insecurity in 2011. If we just simply do a head count of the people living in those households, we get 3.9 million Canadians. That's about 450,000 more than were food insecure in 2008, the last year for which we have nationally representative data. So this is a big problem. It's important, we think, to talk about this problem from the perspective of these national survey measures. Historically in Canada, our window into the problem of food insecurity has come from food bank statistics. For years, we have seen the release of hunger counts by Food Banks Canada, or its predecessor, the Canadian Association of Food Banks. But what I'm showing you on this screen is just an indication of how out of sync those two numbers are. From the 2011 Canadian Community Health Survey, we estimate 3.9 million Canadians were affected by food insecurity, but only a little more than 850,000 people were reported to be using a food bank in the March 2011 survey by Food Banks Canada. What's the disconnect about? Well, surveys suggest that about 1 in 4 people who are food insecure will ever show up in a food bank. Most people don't, and I'll say more about that later on in this presentation. So food bank statistics are a gross underestimate of the extent of food insecurity in Canada. They're also a skewed estimate because, as you can probably imagine, if it's only 1 in 4, it's not a random 1 in 4. The people who show up in food banks are different than the people who don't. For one thing, they've decided to seek charity. But so when we look at the sociodemographic patterning of food insecurity, it's actually quite different than the demographic patterning that you get from food banks. So we think it's really important to start talking about food insecurity, or hunger, the more colloquial term for it, in Canada using these national survey data. Let's go back to Ontario now, looking at the 2011, the data from our 2011 report. What you see here is measures of food insecurity in Ontario over the last, 5-6 years. We're missing 2006 because there wasn't a survey that year, but the other numbers are all from Canadian Community Health surveys run in those years. The blue bar shows moderate and severe food insecurity. That would be the percentages that would be more commonly have been reported up till now for Ontario. The red is us adding on the marginal category, and I've put a very loose error bar on top there so you can get a sense that these are estimates. In fact, these numbers are not significantly different from one another. It looks like there's been a slight drop in 2010, but very, very slight and not statistically significant. The prevalence of food insecurity in Ontario has sat somewhere close to 12% for the last 6 years. To take another look at Ontario's food insecurity in 2011, here I'm showing you the number of households in Ontario versus the other provinces. And what you can see is 573,500 households were food insecure in Ontario, again 11.9%. What I hope you can also see in this graph is that we win the prize. There are more food insecure households in Ontario than anywhere else in this country. Now you might say, that's because there's more people in Ontario than anywhere else in the country. Yes, partly that's what it's about. But it's also got something to do, I think, with public policy in Ontario. The rest of these little bars on this graph are not proportional to population distributions at all. Food insecurity is very, very prevalent in Nunavut, for example, and Newfoundland wins the prize for having the lowest level of food insecurity in Canada right now. So these numbers are not constants that are representative of populations. Another statistic from Ontario that I think is important for you to see is this one. 1 in 6 children in Ontario lived in a household that was affected by food insecurity in 2011. 1 in 6. That matters because food insecurity leaves an indelible mark on the health of children. We've seen over the last few years some publications coming out of the National Longitudinal Survey of Children and Youth. This is a tremendous resource for those of us working in this field. It's a survey that started back in the 90s, and it has tracked a nationally representative sample of children over time. Now they've been tracked for more than 10 years. And what's clear, and this is work by Lynn McIntyre and Sharon Kirkpatrick, what's clear is that children who were exposed to hunger, or in our language of food insecurity, it would be the severe food insecurity category, children exposed to hunger have poor health. They have been more likely to develop a number of chronic conditions, including things like asthma and depression, conditions that they are unlikely to shed as their life goes on. So don't let anyone tell you that food insecurity in Canada isn't a serious problem. It is leaving a mark on Canadian children. It's also a problem for adults. Adults in food insecure households are way more likely to report a whole range of health conditions, all kinds of things, from depression to diabetes to heart disease, hypertension, asthma, back problems, you name it. Food insecurity also interferes with the management of conditions. So no matter what the condition is, if an adult finds themselves in a situation where they're struggling to put food on the table, their health is compromised further. How come people are food insecure? Well, here you see charting of the relationship between household food insecurity and household income, and using the 2011 data from Canadian Community Health Survey. And what you're seeing is a line that goes steadily up. The lower the household income, the greater the probability that the household will report food insecurity. The income, I should just flag for you, isn't an income that you can treat as an absolute value. We have here adjusted it for household size, recognizing that to have $30,000 and live alone is quite different than having $30,000 as an annual income and trying to support 3 people. So that's been taken into account here. The line moves steadily up. It becomes a dotted line as we get into those higher income areas because the estimates are so unstable because we've got so few people who are food insecure in those categories, as you'd expect. But what you can also see is that we never get to 100% here. Income's only part of what explains which households in Canada are food insecure. And that's because income is only a partial representation of the overall resources that a household has to allocate to food. Some other correlates of food insecurity that have been consistently documented through multivariate analysis of population surveys with CCHS and its predecessors are the lack of home ownership, being of Aboriginal status, being a lone parent household, and being reliant on social assistance. So all characteristics that signify a household that, in addition to having low income, has other markers of vulnerability. Let's take a closer look at a couple of these things. Let's start with social assistance. About 65% of households reliant on social assistance in Canada in 2011 were food insecure, and they comprise 16% of all food insecure households. And that's a huge overrepresentation of them in the population. They comprise something like 1% of food secure households. What's that about? Well, incomes fall below basic living costs in most jurisdictions for people on social assistance. The most egregious example of that in Ontario is Ontario Works, the welfare dimension of social assistance in this province, and it is a particularly problematic program for people who are classed as singles. The income levels of people who are single and on Ontario Works are well below anything any rational person could think would cover basic living costs. In addition to income, though, there are other issues related to social assistance programs in this province and others that render recipients vulnerable to food insecurity. The biggest of these, I think, is the asset limits. Before someone is able to qualify for welfare, they need to have liquidated any assets they've got, because this is supposed to be the income support program of last resort. So if they have a house, they're usually compelled to sell it. If they have a car, they need to sell that. If they have savings, they need to spend them. So by the time they finally receive a welfare check, they don't have hardly anything left. And that's a problem for them, because even if they are able to balance the budget, their budget some of the time on social assistance, if anything ever happens that they have an imbalance where either their check is delayed or they need to spend more money than usual on something like a pair of shoes, say, or a bus ticket, if any sort of an income perturbation is enough to plummet them into extreme levels of poverty. Another thing that we've learned from looking at these Canadian community health surveys that may not be something that you're aware of is that while people on social assistance are particularly vulnerable to food insecurity, most food insecure households are actually relying on employment incomes. Employment protects most of us from food insecurity, but still when we do a head count of who's food insecure, about 60% are relying on employment incomes. That's a problem of low wages, but not just low wages. It's also an issue related to the fact that these households are relying on people with short-term part-time employment and often multi-person households trying to rely on the income of one earner as opposed to two earners. The problem, though, of food insecurity amongst working poor in Canada isn't just about the employment conditions. It's also about the inadequacy of our income transfer programs that are supposed to be designed to supplement low employment incomes. We can't expect every business in the country to pay a wage that is sufficient to feed a family of 5. So we, for years, have known this, and we've got things like tax credits, tax benefits, tax deductions, that through our income tax system, we transfer money from people like me, who earn way more than I need, to people who are also working but not having the luxury to have such a high salary. But that income transfer system is broken, badly broken, and that's how come we can find 60% of food insecure households to be relying on employment. The last income source I want to speak to are seniors' benefits, because there's been some research recently by our colleagues in Calgary, Lynn McIntyre and Herb Emery, that points out that to be reliant on seniors' income is actually to be protected from food insecurity. Only 7% of households reliant on seniors' income are food insecure, and they comprise only a disproportionately low fraction of food insecure households. What's that about? Well, unlike the rest of us, to be a senior in Canada is to have a guaranteed annual income, and it's an income that's indexed to inflation. Now, welfare programs aren't indexed to inflation in most provinces. They're certainly not indexed to inflation in this one. But once somebody turns 65, they've ended up with an income that is not only higher than most welfare recipients, but also one that is indexed to inflation. With it come other benefits, things like drug coverage, transit subsidies, senior discount days. You can have a senior's day at Walmart or Shoppers Drug Mart or wherever. So there are all kinds of ways in which we confer benefits to someone once they hit 65. And that's working, as evidenced by the fact that they are at so much lower risk of food insecurity than any other group in our country. What about public policy? Well, I'm just going to have to ask for some technical help here to get my picture off my slide. Sorry, folks. I think your vision is easier than mine, but I'm having a hard time to see some of what's on these slides because my face is covering them. Imagine. Okay, thanks. Well, we've got public policies that are designed to provide some kind of a social safety net. We've had them for years in Canada, and actually we should be very proud of them. We've got things like employment insurance, we've got social income assistance programs, welfare, disability support, old age pensions, we've got subsidized housing. These programs are programs all designed to ensure that people who, for whatever reason, are unable to garner sufficient income through attachment with the labor force have some basic standard of living. Unfortunately, these programs are not designed to prevent food insecurity. And the fact that we can find 1 in 6 children in Ontario, for example, living in food insecure households suggests that they aren't doing that. In recent years, we've seen Ontario and several other provinces come forward with poverty reduction strategies, recognizing that we've got problems of poverty that need to be dealt with and aren't being handled appropriately by these other programs. We've seen the introduction of things like the Ontario Child Benefit. That's great, but again, we're seeing the introduction of initiatives that are not designed to tackle food insecurity and that don't appear to be tackling food insecurity, as evidenced by the fact that In spite of Ontario's poverty reduction strategy, food insecurity persists in this province and has barely moved over the last few years. What this says, I think, is that food insecurity needs to be a public policy priority, that things like poverty reduction strategies, while great ideas, can't be presumed to trickle down to lower rates of food insecurity. There's absolutely no evidence from the Canadian Community Health Survey data that that's happened. So the way to tackle food insecurity is to tackle food insecurity, not to tackle other things and presume that they're therefore will lift people who are food insecure out of that condition. It doesn't appear that that's working. Just to pause for a moment and comment on the Nutritious Food Basket, I was happy to be invited to present as part of this webinar because of the front-end presentation of the Nutritious Food Basket. As one who is a user of data from the Nutritious Food Basket, I just want to flag my views on it, which is that it is a critical tool for us. The comparisons that people can do with using Nutritious Food Basket costing data and shelter costs to look at the affordability of a nutritious diet for people on welfare or disability support programs or pensions or whatever is invaluable. It provides an objective measure of affordability that we can't get from any other sorts of data. So that activity of doing these case studies where, the scenarios where the Nutritious Food Basket costing and shelter costs are combined and compared with incomes from a variety of sources is very important. With standardized measures, the Nutritious Food Basket costing also enables us to track progress, or the lack thereof, over time and across jurisdictions. I also think that the comparisons using the Nutritious Food Basket data can facilitate the identification of vulnerable subgroups within programs. And the example I offer here is the difference between the affordability of the Nutritious Food Basket for people on welfare if they have young children or if they have teenagers. If they have girls or if they have boys, if they have a menstruating girl or not. There are many, many differences that can be peeled out that help us to figure out what some of the problems are with the design of existing income support programs and how those programs can be made to provide better support. Lastly, I think the Nutritious Food Basket costing work is underutilized insofar as it can be a tool to evaluate food-based interventions. And I give you an example here of a paper that we did a few years ago using Nutritious Food Basket costing to look at the income transfer potential of the Canada Prenatal Nutrition Program and school feeding initiatives. Okay, I'm making a case for advocacy, but I can imagine some of you are thinking, what are we supposed to do in the meantime? And that's been the thought in Canada for decades now, sadly. Doing something in the meantime. I suggest to you that we have two kinds of programs that are operating, well-established initiatives in our communities now that are programs to do something in the meantime. We've got food charity, food banks, charitable meal programs, snack programs, and breakfast programs. We've also got a variety of community-based food programs that are intended, among other things, to help improve low-income groups' access to nutritious food. The examples I give you here are community kitchens, gardens, farmers markets, and good food boxes. It's not very often that these programs get evaluated against household food insecurity in the way that I've talked about it. The presumption often is that the fact that these things exist and that they are doing something about food means that they have to be doing something valuable. Well, I think there needs to be way more interrogation of that question. But what I'd like to offer you is my insight into that question that comes from the work that we've done in Toronto. Through 2005 to 2008, we were funded by the Canadian Institutes of Health Research to do a study of families living in high poverty neighborhoods in Toronto. And I apologize, I know from looking at the list of people who signed up for this webinar that some of you will be quite familiar with the study, so you might want to read a magazine right now. We basically knocked on doors in high poverty neighborhoods, selecting families that were either tenants in market rental accommodation or people in subsidized housing, and asking them a number of things, including that 18-item food security module. What you see here is the prevalence of food insecurity in our sample. It was overwhelming. Almost 8 out of 10 families reported some level of food insecurity. 28% were severely food insecure. That's more than 10 times the national average. The levels of food insecurity were appallingly high. And when we went back a year later and interviewed as many of these families as we could retrieve, I think about 77% of the initial sample, what was also absolutely heartbreaking was to see how many of these families were still food insecure. 77% of families that were severely food insecure at baseline, 12 months later, were still severely food insecure. Now think about that. It means that when we're looking at these 12-month measures from things like CCHS, we only are seeing a 12-month window, but if our sample in Toronto is representative at all of low-income families elsewhere, it must mean that in many of these families, the situation is chronic. So we asked a number of questions to look at the interface between the household experiences of food insecurity and community programs. What you're seeing on this slide is the proportion of families who had used food banks in the last 12 months. And we've divided it up, or this is Rachel Lukestra's work. She's divided it up by household food security status. And you can see what you'd expect to see, that the probability of using a food bank increased as families became more severely food insecure. So it seemed to be a strategy of desperation. The red bar on this graph, however, shows you how many households in each of these categories didn't use a food bank. And what you can see from that red bar is that most families in the study didn't use a food bank at all in the last 12 months. Only 4% did anywhere near monthly use of food banks, and only 23% used a food bank at all in the last 12 months. So the utilization wasn't nearly as high as you'd expect. What's also interesting to take a look at is this, the food security status of people who did report using food banks. The majority of people who used food banks in this study were severely food insecure families. Others were moderate, but you can see only a tiny slice of this pie graph are people who are food secure. Now, think about what that means. If food banks actually are preventing people from going hungry, then this graph should look like this. Most of the people in the graph should be either food secure or marginally food secure, but they shouldn't be severely food insecure. What I think the data from this study show, and I'd encourage you to take a look at our paper in the journal called Canadian Public Policy, but what I think this analysis shows is that food banks are a strategy of desperation. Most food insecure households aren't using them, and those who are still struggling to put food on their table. Because the rates of utilization were so low, we went back in the follow-up survey with these families and asked those who weren't using food banks why they weren't using them. Here you see a very coarse summary of Rachel's analysis of that. It seemed like for about 2/3 of the families, the reason they weren't using a food bank was because it didn't make sense to them. The food that they would get wouldn't be food that they would be able to use. They were resistant to using charity. They didn't see it as a thing that a person of their nature should do, or they didn't feel like they were so desperate. Food banks were for somebody else. They weren't for me. But I mean, the overwhelming message, I think, on this slide is that there was a disconnect between what food banks were offering and what these people perceive themselves to require. About 1/3 of families described barriers to using food banks. In some cases, these were logistical barriers, not having information, not being able to go, people telling us, you know, I work, I can't go to the food bank because the food bank in my neighborhood's only open on Wednesday afternoons and I work that day, or I can't get there on weekends because there's nobody open in this neighborhood on weekends. Other people who told us they had gone and been turned away because they weren't eligible. The food bank in their area was only serving people maybe on welfare and they worked, or people of other sorts. So lots of logistical barriers, but still the vast majority were more, I think, cultural barriers than logistic. What about other food programs? Well, the participation rates in community gardens and kitchens and good food boxes was very, very low. I should tell you that we have done work looking at the availability of these programs and also at the availability of food banks in the neighborhoods where we surveyed. And there were programs available in these neighborhoods. So The low participation rates you're seeing here are not about the neighborhoods not being well served. These are high poverty neighborhoods in Toronto. They have been a priority for all sorts of interventions for years now. So it isn't about there not being a garden, the fact that we can only see 3% of people participating in them. Even with these small numbers, though, we did our best to look at the relationships to food insecurity, and we weren't able to establish anything that suggested that even with more numbers, we'd be able to find an effect of protection against food insecurity with program participation. Again, we asked people why they weren't participating. Many said it was because there were barriers to use, but there were also a substantial number of people who said it didn't make sense to them. They were too busy to attend a community kitchen or a garden. Remember, and this is something I think that people who talk about these programs don't recognize often enough. Remember, most people who are food insecure in Canada are working. They're not on social assistance. It's also true that most people who are food insecure in Canada are caring for children. So things like a garden or a kitchen that require time are not necessarily things that people can accommodate. There were also people who talked about these programs not resonating with their interests or priorities. What was absolutely clear in the responses is that people didn't see them as something that was going to likely solve their problems of food insecurity. We also looked at food retail access, which is, I know, a popular thing for people to talk about locally now in terms of thinking about what can happen at a local level to improve food security for low-income households. The neighborhoods that we looked at were, for the most part, very well served by discount supermarkets. We could see no association between proximity to discount supermarkets and food security status. We also could see no association between whether or not a family incurred transportation costs for grocery shopping and whether they were food insecure. I want to emphasize this last point because often when people look at availability of food in low-income neighborhoods, they think if food is within walking distance, people will save money because they won't have to pay for transportation. In fact, from our work with this Toronto sample, that's very naive. If a woman is going shopping to buy food for herself and her 3 children, unless she has a vehicle, she has to pay for transportation because she can't carry all that stuff home. Think how heavy something like a bag of milk is. So the transportation costs that households in this sample incurred seem to be independent of proximity to retail. To conclude, our research and the report that we're about to issue on the 2011 CCHS results, I think, argue strongly that this is a serious problem, but it's a problem in need of policy interventions. It is rooted in problems of social policy, and its solutions also lie in those. Any local programs that are working in the meantime, things like food banks or community meal programs or some combination thereof, I would argue need to really think through who they're serving, to make sure that if you are doing something that you think can make some difference in somebody's life in the meantime, that to be sure that that is actually reaching people who are food insecure and that it is offering supports that they experience as helpful. And lastly, I want to say that I think advocacy needs to be integrated into these meantime activities. It is really, really important that we not give anybody the illusion that these things are a solution. With 1 in 6 children in Ontario now living in a family that is food insecure, we have a serious problem, and we can't afford not to act on it. And so we need to be under no illusion about that with any of these other sorts of meantime activities. I want to end with a word from our sponsor. I've mentioned throughout this presentation that we are about to do an annual report on the results from the Canadian Community Health Survey from 2011. I would encourage you all to sign up for our website. On that website, you'll see access to some of the publications that I've cited in this presentation, and you will also be able to receive notification and a copy of our annual report when it's released, probably in another 10 days. Thanks very much for your attention and your participation in this webinar. I'll be happy to answer any questions anyone has now.